National Health Mission Employees Association of Nagaland (NEAN) in a late-night meeting yesterday postponed its indefinite cease work for 15 days following assurance given by Nagaland Minister for Health and Family Welfare S. Pangnupom. NEAN President Dr. Sachinlo Mag and General Secretary Kewetso Kenye said NEAN executive at a meeting decided to temporarily suspend the cease work following a meeting with the Health Minister. The minister appealed to the executive to give time to the government so that the department could work out the modalities of the demands, then come out with written proposal. The demands of the association include regularization of services of the state National Health Mission employees, pay parity with state health employees of same rank, and all basic employees benefit in line with the Health and Family Welfare Department employees. While National Health Mission Employees Association of Nagaland has called off its indefinite cease work, the point about regularization of National Health Mission employees will invoke the ire of associations like Nagaland Medical Students Association and Nagaland Junior Doctors Association. Both associations have demanded the cabinet revoke the decision with regard to gazetted appointments. NJDA has demanded re-advertisement. Meanwhile, ACOUT has also pointed out the regularization on contingency basis was totally against established rules and norms of the department, giving way to nepotism by taking undue advantage of COVID-19 situation. On August 3, 2008, Guwahati High Court bench had directed the state government not to appoint or regularize services of those employees who have been appointed on contract or ad hoc basis, even though they may have completed 3 years of service. In its efforts to meet the challenges of COVID-19, the state government has taken some glaring missteps, putting itself in a messy situation. At last, there is a glimmer of hope that COVID-19 or coronavirus may be contained with a steroid drug called dexamethasone. Dexamethasone has become the first drug shown to be able to save lives among COVID-19 patients in what scientists said is a major breakthrough in coronavirus pandemic. Initial tests in the United Kingdom in 175 hospitals indicated that the drug showed significant improvement on patients who were given a daily dose of 6 milligrams for 10 days. 2,104 patients were administered the drug compared with 4,231 patients who did not receive the drug. Results showed that it cut the risk of death by a third, which means that the drug-administered patients had a 75% chance of recovery. Dexamethasone was most effective amongst the most severely ill of COVID-19 patients admitted. The drug is administered to patients in severe conditions and on respiratory support. Patients that are not on respiratory support are not administered this drug since it is found to be non-beneficial. Dexamethasone is the only drug that's so far shown to reduce mortality, and it reduces it significantly, bringing hope to those who are severely ill with coronavirus or COVID-19. In an effort to bring back stranded citizens, altogether 280 people reached Dimapur by flight today. Out of the 280 people, Air India brought 130 from Kolkata, 30 from Guwahati, and 37 from Imphal, while Indigo flight brought 83 people from Kolkata. Kohima passengers were sent directly from airport after screening by medical personnel, while remaining passengers were taken to Agri Expo at 4th Mile Dimapur for further segregation and transportation to designated quarantine centers. With COVID-19 cases on an upward spike all across the country, including the Northeast, the COVID-19 status of the northeastern states as of 8 p.m. today are: Arunachal's tally rose to 99 positive cases with 92 active and 7 recovered. Assam's tally rose to 4,606 positive cases, 1,952 active, 2,643 recovered with 8 deaths. Meghalaya's tally stands at 44 positive, 15 active, 28 recovered, and 1 death. Manipur's tally rose to 500 positive cases, 341 active, 159 recovered. Mizoram's tally stands at 121 positive, 120 active, and 1 recovered so far. Nagaland's tally stands at 193 positive cases today, with 90 active and 103 recovered. Tripura's tally rose to 1,090 positive cases, 533 active, 556 recovered, and 1 death so far. Sikkim's tally stands at 72 positive cases, 64 active, and 8 recovered as of today. The total number of COVID-19 cases in the region stands at 6,725 positive, 3,207 active, 3,505 recovered, and 10 deaths as of today. From all of us here at NE8, stay strong and stay safe.